Alberta is developing plans to reimburse more people for private medical testing if a serious condition is found. It's part of a new proposal to expand diagnostic screening. But critics say it pushes the province more toward two-tiered health care, and there are worries it could put more stress on an already burdened system. Jordan Canagan reports.
It's pitched as a plan to allow Albertans to take proactive care into their own hands.
It is much easier to deal with cancer or a chronic illness if you can find it early through these detective modes that will be available for people to pay for themselves.
And the province is working on a system to allow people to be reimbursed for those private MRIs and CT scans if a serious medical condition is found.
Right now, the doctor's the gatekeeper. The doctor's the one who determines whether or not a test should be performed. We want to move to a model where a patient can go directly and get those tests and then be able to get them reimbursed if there's a problem.
But some worry the changes could mean those same doctors will take on even more of a burden as more public and private results are reviewed by physicians.
So we want to make sure that we're still following guidelines with regards to ensuring that every Albertan who's a candidate for screening has that screening available to them, and they are not delayed because of this new program.
In a statement, Health Canada says Canadians should have equitable access to medically necessary care based on their medical needs, not their ability or willingness to pay. That's why the Government of Canada continues to invest in strengthening our publicly funded healthcare system. There's also a worry it could bump publicly covered patients waiting for scans and add to growing wait lists. Data from the Canadian Institute for Health Information shows wait times for MRIs and CT scans jumped in Alberta in 2024 compared to the prior year.
What we've seen yesterday is the government announcement for more American-style two-tiered healthcare in Alberta.
And Jordan joins us now from the southeast. So Jordan, when could these changes come?
Well, Tara, even though the Premier and Health Minister already announced these proposals, there's still a lot of work that needs to be done. Public feedback hasn't started, and the legislation is still being worked on. While Adrienne LaGrange says that it will comply with the Canada Health Act, a spokesperson from Health Canada says they're still reaching out to Alberta to try to better understand the implication of these changes. The legislation is expected to be introduced in the spring. Tara?
Okay, Jordan, thank you.